Peyronie's disease is the name that we give to the development of penile curvature or deformity. Some men are born with penile curvature, and if that's the case, we call it chordee. But if there's been a change in the appearance, shape, curvature of the penis in adulthood, we call that Peyronie's disease. Fundamentally, Peyronie's disease is a disease of wound healing. We don't realize this, but every time we have erections, every time we have intercourse, there are microscopic damages to the tissues of the penis, the same way that if we go to the gym and lift weights, there's microscopic damage to our muscles. Under ideal circumstances, the body heals these micro traumas with healthy tissue, but for some men, instead of healthy tissue, we develop scar tissue. Scar tissue, of course, does not stretch like healthy tissue does, and so it acts as a fulcrum to cause narrowing or curvature of the penis. Unfortunately, Peyronie's disease can have a negative impact on our erectile function and on sexual intercourse. We know that men who develop Peyronie's disease have a slightly higher risk of erectile dysfunction as compared to men who don't have Peyronie's disease. And the curvature of the penis can make intercourse painful for men, painful for their partners, or in some cases, completely impossible because of the severity of the curve. Typically, the diagnosis of Peyronie's disease is made initially in the office, where we meet to take a history and to do a physical examination. Oftentimes, we can feel the scar tissue in the erectile bodies of the penis, even in the flaccid state. Most commonly, though, I perform something called a duplex penile ultrasound, which is an ultrasound where we evaluate not only the blood flow, but also the scar tissue in the penis to determine the presence and severity of Peyronie's disease. Fortunately, there are many treatment options available for Peyronie's disease, ranging from medical therapy to restorative procedures. In the office, we will discuss all of these options and make a recommendation based on the severity of disease and what we might find on a duplex ultrasound. The appropriate treatment for Peyronie's disease is determined based on history, physical examination, and the findings of the duplex penile ultrasound. The most common consequence of not treating Peyronie's disease is simply that we won't get better. We know that once the curvature of Peyronie's disease develops, 85% of the time, that's how we're going to be long term. It's very unlikely to get better on its own. It's very unlikely to get worse. And so depending on the severity and whether men are having difficulty with their erections or difficulty proceeding with intercourse, that really determines whether and when we should be treating Peyronie's disease.